How do you know if you're at risk of cancer? Has the detection of cancer gotten that much more sophisticated over the last 100 years? This is all much more advanced than most people realize. Welcome to the Crossover Connections with Jack Wang podcast. My name is Jack. I'm a scientist and college professor at an Australian university. Let's get the elephant out of the room first. There will not be a cure for cancer, as the press likes to report it. Every new discovery in cancer therapy is deemed as a cure, and that is actually very counterproductive to the conversation around cancer biology and the conversation around cancer research that needs to happen to take the next step forward. 1 in 3 people will have some form of cancer and will develop some form of cancer at some point in their lives. The first myth to dispel: there is not one uniform type of cancer that affects everyone. People who are trying to treat different types of cancers are combating against at least 40 different types of cancers. Let's look at how cancer is diagnosed. It was diagnosed as a disease that had no treatment anyway, so detection didn't seem that much of a concern or a priority, but detection is absolutely a priority in this day and age. Bowel cancer is something that is typically associated with older demographics of people, but this article is saying that even young people can be at risk of bowel cancer. In Australia, we have home testing kit that you could basically submit as part of the National Bowel Cancer Program, and we post these free home testing kits to Australians between 50 and 74 years of age every 2 years. This is a real measure of progress in this type of cancer. We're very good at diagnosing it if you know to look for it. Skin cancer, specifically a very aggressive type of skin cancer referred to as melanoma. In Australia, we're blessed with amazing sunshine most of the year. We have trained hairdressers, barbers, and beauticians to detect melanomas. Like, you never see the back of your head, or certainly rifle through your scalp at the top of your head. These are parts of us that we never really see routinely. So it would make a lot of sense for barbers, hairdressers, and beauticians who see these weird spots around our head. They're actually a really good focal point as part of the diagnostic effort for skin cancer and for melanoma, because melanoma can be anywhere on your body and it can come down to a little red blemish or a dry, flaky bit of skin. Early detection is absolutely essential when it comes to skin cancer. A combination of cutting the cancerous tumor out, multiple drugs, and maybe some localized chemotherapy might be useful. We've gotten so sophisticated at detecting it, we can train barbers, hairdressers, and beauticians to recognize these melanomas. There is lung cancer screening clinics that have become more routine in England, a nationwide screening program, especially deciding to focus on smokers and former smokers within a certain age bracket, aged 55 to 74, invited to get their lungs scanned. This is using a low-dose computerized tomography or a CT scan to look at the lungs, to look for certain lesions or abnormal growths. This clinic is mobile. It's on wheels. It will travel around to different locations in the UK and really invite people who are in these risk categories to go in and get their lungs scanned. If there's any early signs of lung cancer appearing, that will direct them to treatment that much earlier. Doesn't just stop there, because we can also leverage AI to help diagnose different types of cancers. And the next article talks about the use of AI in detecting breast cancers, doing an X-ray and taking an image and then looking at that image of breast tissue to see if there's potential cancer or cancerous lesions or tumors that can be found anywhere in those scans. And it's the picture that comes out that then needs to be interpreted by an oncologist. You need specialist training to be able to read these mammograms and not to overinterpret or not to underinterpret. So it takes a lot of expertise, and there is human judgment involved. The mammograms, when submitted as part of an AI training toolkit, the AI algorithms are much more consistent in being able to pinpoint potential cancers. They followed 80,000 women who attended a screening program in one area of Sweden, 36,000 fewer screenings read by the radiologist and the AI supporter group, and there was a 44% reduction in the radiologist screening workload. This is all much more advanced than most people realize. There is no cure, but we've made such incredible advances in the last 20, 30 years. To dismiss that there's no cure is really doing a disservice to all of the people who work in healthcare, in medicine, in diagnostics, in the science research part of the pipeline. And depending on the kind of cancer you have, the prognosis can be very good, especially if you get detected early on. The downside of this is that there is this concept that's referred to as overdiagnosis. And in fact, in Australia, 29,000 cancers every year are overdiagnosed. 1 in 4 cancers detected in men in 2012 were an example of overdiagnosis. The cancer is indeed an overgrowth of cells, but they are harmless, that either never grows or grows very slowly. They're low or ultra low risk cancers that wouldn't have spread or caused any problems, even if left untreated. Picking up these extra growths on scans and being more conservative and subjecting patients to treatments, some combination of radiation therapy or chemotherapy and surgery, which are not risk-free procedures. We are also causing an incredible amount of health anxiety and family stress, knowing that someone in your family has cancer. Maybe then it's genetic and everyone else in the family needs to go get screened. It causes a tremendous amount of stress. I think we're still seeing the unintended consequence of this unfold for a few years to come. We need even more sensitive diagnoses to be able to differentiate from cancers that are truly benign, harmless if left untreated, versus cancers that will deteriorate very quickly and grow and cause very fatal circumstances for the patient if left untreated for even a month or a week. The key to overcoming the problem of overdiagnosis is not less diagnosis, it's improving the sensitivity and accuracy of our diagnostic methods, which comes back to research and development. I'm Jack, hope to connect with you again next time around.